have confirmed the urgent need to address the regulatory challenges affecting the equitable access to medicine and healthcare products in Africa. Citing conditions affecting the development of Africa's new public health order, it was agreed that a global regulatory standard will remain a critical undertaking to decrease Africa's reliance on foreign healthcare products and imports. The WLPF, which comes to a close, provided a platform for participating members to call on global health organizations to play a key role in developing an enabling ecosystem for the local production of medicine, vaccines, and diagnostic test kits in Africa. Earlier on, Michael Mynhardt, a business strategist for investment and manufacturing, joined us from The Hague, Netherlands, for more on this.
What it comes down to is a global realization that Africa is completely dependent on the rest of the world. So the conference really has focused on how do we create an African ecosystem that's more self-reliant, that's less reliant on the rest of the world, and ultimately more dependent on its own infrastructure. Then if you look at the regulatory landscape, quite honestly, within Africa and even the rest of the world, there's quite a disconnect in that there's a number of different standards that get used depending on the region that you're operating in. So it's quite fragmented and quite disconnected as we speak. What you're looking for at the moment is ultimately additional funding and additional infrastructure to be built on the African continent to allow it to become more self-sufficient. So the regulatory element is just one aspect that's hindering that from actually progressing further.